here it is, the final lecture on the urinary system. Last time we talked, we were going over ADH and regulating blood concentration. Now I got to talk about another hormone, aldosterone. Aldosterone is made by the outside of the adrenal gland, known as the adrenal cortex. Aldosterone is made when sodium levels in the blood are too low. So obviously, it's going to make the kidney reabsorb sodium to bring them back up. It's made when plasma potassium is too high. So clearly, it's going to make the kidney secrete potassium to get that plasma level to go down. It's also made in response to angiotensin 2 because it is going to help you increase blood pressure. Now, aldosterone acts mainly on the DCT, a little bit on the collecting duct, increases the secretion of potassium, reabsorption of sodium. Reabsorbing sodium causes you to reabsorb more water. Reabsorbing more water is going to make blood volume and blood pressure go up. All right, 5 questions for you to do here. I'll let you do those at your leisure. Let's talk about diuretics for a bit. Diuretics are anything that make you pee more. So water, any drink, is going to be a diuretic. It's going to make you pee. Anytime you increase blood volume, it's going to make you pee more. Anytime you dilute blood, it's going to make you pee more. There are other things, though. Some diuretics are osmotic diuretics, where they increase the particle count of the filtrate, thus dragging more water into the filtrate, and thereby increasing the urine output. Caffeine is a commonly noted diuretic, and it stops the reabsorption of sodium in the kidney. You reabsorb less sodium, you reabsorb less water, which means more water gets peed away. Meanwhile, alcohol, another classic diuretic. Alcohol works by inhibiting the release of ADH. So think of alcohol as an anti-ADH, anti-diuretic hormone. In other words, it is a diuretic. It's going to make you pee. All right. Speaking of urine, volume generally varies from 1 to 2 liters per day. Normally, it can be more, it can be less, depending on how much you're drinking. pH, usually on the acidic side, usually 4.5, 5, 6. Sometimes it can be neutral, up till 8. Depends on your diet. You know, whether you're a vegetarian, how carnivorous you are. Color, of course, clear to yellow, depending on the concentration, depending on how much water is in there. And it's usually mostly water. Solutes, roughly 5%. Uric acid, which is a product of purine metabolism. Adenine, guanine, your nucleotides. You break down DNA and RNA, you make uric acid. Urea is a protein metabolite. Creatinine, muscle metabolite. And of course, there will be the usual slate of ions as well. All right, organs that move and carry urine. The ureters, nice retroperitoneal tubes running from the kidneys down to the urinary bladder. Ureters have an adventitia around them to anchor them in place. Then a smooth muscle, muscularis, which is going to do peristalsis to move that urine to the urinary bladder. Notice the mucosa has folds to allow it to unfold. Technically, I don't think these guys are called rugae. I've never seen them called rugae. You can think of them as being like rugae if you'd like. The epithelium in here, of course, is transitional, which is the stretchiest epithelium you and I have. And here is the lovely urinary bladder. We see it down here. We see its detrusor muscle in here. Remember, to detrude means to expel. Transitional epithelium would be lining it here. I see the folds, the rugae. I see the smooth region without the rugae. It's the trigone, demarcated by the 2 openings for the ureters, as well as the opening for the urethra, which of course is the internal urethral orifice. The trigone helps to funnel urine down through the urethral orifice into the urethra. Of course, realize the smooth muscle directly adjacent to the internal urethral orifice is the internal urethral sphincter. It is smooth muscle, and thus it is involuntary. The urethra in both boys and girls has to pass through a skeletal muscle layer called the urogenital diaphragm, which is this rectangle here, and we'll talk more about it in a second. The urogenital diaphragm contains a little ring of smooth muscle encircling the urethra. That ring of smooth muscle in the urogenital diaphragm is the external urethral sphincter, which is your mostly voluntary urethral sphincter. All right, cool. Here's a slide of the urinary bladder. Check out the mucosal folds here, which can unfold. This is transitional epithelium. Kind of hard to tell at this magnification though. And down here we have the smooth muscle muscularis, better known as the detrusor muscle. And here is the entire muscular floor at the bottom of the pelvis. This is a girl pelvis here. We see the muscular floor here. This is the pelvic diaphragm. How do we know this is a girl? Well, we see 3 tubes: rectum, vagina, and urethra. The muscle directly around the vagina and the urethra would constitute the urogenital diaphragm, which of course contains the external urethral sphincter. Here we see the lady urethra again, from the internal to the external orifice. Short urethra means that there is a higher risk of bacterial infection, plus the proximity of the urethra to the vagina, to the anus, makes it easier for bacteria to find their way into the urethra. Notice that the urethra terminates at the external orifice, which is in the vestibule of the vulva, enclosed by the labia minora. Here's the urogenital diaphragm, part of the pelvic diaphragm, and inside it we have the external urethral sphincter, and there, part of the detrusor muscle within the bladder wall itself, is the internal urethral sphincter. Here's the boy version: longer urethra with different sections, prostatic in the prostate gland, membranous within the urogenital diaphragm, and then penile or spongy within the corpus spongiosum of the penis. More about that in the repro lectures. Last but not least, the act of peeing, better known as, well, not better known as, also known as micturition, the micturition reflex. When the bladder stretches, stretch receptors send a signal to the spinal cord, goes up to the pons, to the micturition center. Pons says, okay, time to pee. Sends a signal down. Signal goes out to the urinary bladder. It's a parasympathetic signal telling the urinary bladder, hey, contract. Telling the internal sphincter, hey, relax. But luckily, we've got somatic motor control over the external sphincter, so we can delay and then shut off this reflex until a more convenient time. Now, bear in mind, when you turn this reflex off, it'll go off for a little bit, but then as more urine accumulates, it'll turn on again with greater intensity until it reaches a point where it cannot be shut off. And that's it. Urinary system is done. Hooray. See you later.